We'll be talking about is actually a surgical emergency, and this is what is known as the intussusception. All right, intussusception. If I would describe intussusception to you, right, let's say the intestines are continuing like this, so all of a sudden this segment of the intestine collapse into this one. Are you seeing it? All right, so if the segment of this intestine collapse into this one, you can have a compression on the blood supply, and that segment of the intestine, you can have the blood supply cut off. So if the blood supply is cut off, the tissues will actually start becoming hypoxic and the tissues could die off. All right, so it's not for us to describe everything about intussusception. You remember that this is a pediatric exam, so in pediatric exam they will ask you some subtle questions here and there just for you to get some 1 or 2 marks. So for this one, they ask that the students to state 5 clinical features of intestine intussusception. You should also talk about 5 laboratory findings for intestine intussusception. So these are direct questions. If you go and you start discussing everything, it's your time you are taking up because it's an exam situation. So you just go straight to what they asked you. So for the clinical features, we have intermittent severe abdominal pain. Intermittent simply means it's actually coming and going. So you have episodes of crying, drawing knees to the chest, a lot of things. So the child could be vomiting, and the vomiting is usually green, like the vomiting is green. They call that a bilious vomiting. There's passage of stool that is red. The stool is red and sticky. They call that a red currant jelly stool. Why is the stool red and sticky? It's because it's mixed up with blood and mucus. Okay, then there's lethargy, there's palpable abdominal mass. Okay, that they call that a sausage shaped mass. So the necrotic tissues of the intestines are beginning to swell up, so you can palpate it. So laboratory findings, you see that white blood cells will be elevated because of stress and inflammation, anemia due to chronic illnesses, electrolyte abnormalities, okay, because the child will be vomiting. Of course, food is not passing down. Okay, vomiting, dehydrations. Okay, so there's signs of dehydrations, okay, on chemical profile. So that's what we have for this question.